report, and it worked on different floors. I know every floors have their own format for handover reports. But I usually work according to this report, and I'm gonna share how it looks like. I also have it in the link in my bio. You can download it and you can use it, and you can add more if you want in the same report. So yeah, let's get started. Yes, so this is how my report looks like. This is the structure that I usually use to get all the reports done, and I have used this report on multiple units. And just a disclaimer, the patient information that I have here is completely imaginary. It's not a real patient information. I'm not breaching any patient privacy. I just entered this information here, like imaginary information, so that I can show everyone how it looks like when you have actual report done. So we have patient information here on this side. Patient name is Jane Doe, 68 female. Full code, we need to know the code status if they are full code, DNR restricted, DNR advanced, comfort, which team they belong to, because sometimes we need to call the team to inform something or get orders. So we need to know which team they are, and if they are allergic to something. Sometimes people miss this information, but it's really important information because you need to know if your patient is allergic to any specific medication or food items. What's their isolation status, if they're MRSA positive, if they are contact precaution. Um, Sometimes there is a banner on the door, but sometimes people miss that. People forget to put it there, so we need to know what's going on with patient. Their important contact information, and what's their primary diagnosis. I forgot to put something here, which is history, but I think I entered this information on the actual document, which is in my bio. So you can check that there. And so we need to know what's the primary diagnosis, what's their history, um, what happened when they were admitted, how they were admitted. So as you can see, they presented to ED with shortness of breath, fever, hypertension. They started IV for fluids, and we want to know what's their mobility if they use walker, wheelchair, 1%, 2% assist, or their falls risk. So we need to know that information. That's important information. And here I have head to toe information, neuro, cardiac, GIGU, respiratory, skin,